The issue has always been, how do you change behavior? And I don't think doctors or particular or neurosurgeons are unique. It has to do with any human behavior. Once somebody's used to doing something, it's very difficult to change them to do something else. Is, listen, I've been doing this for 20 years. I'm used to it. You know, half my patients die. I don't want to try anything new because maybe the other half will die too. So, you know, I want to just do what I've been trained to do. And changing that behavior, or how to do that, has been very difficult. I think now the guidelines have been well accepted. People are saying, okay, what's next? You know, what do we do? And right now we just had the second edition of the pediatric guidelines is about to come out. We're about to publish an algorithm for managing intracranial hypertension. So we continually keep up with the guidelines. And we're going to shift to a process of continuous updates. So people will get the news right away when, say, like the CRASH trial for don't use steroids for people with severe traumatic brain injury because it actually increases mortality. Those kinds of articles will come up immediately, and recommendations will be in place. So I think there's going to be a direct connection between the person taking care of the patient and what the newest evidence is. So far it's been very disconnected. Some journal somewhere published something. Well, then how do you take that knowledge and then bring it to the bedside? That's been the difficulty. And we've had this program in New York State, and we actually have it in other states as well, where we actually track patients in coma. We actually have a free tool called www.tbiclickandlearn.com. So if you go tbiclickandlearn.com, it's a free tool. You can put in the person's neurological status and their blood pressure and so on. It'll tell you if they're following the recommendations of the guidelines, and give you the guidelines. You can look at it and look at the evidence supporting the recommendations and so on. We hope to have that as sort of a public bulletin or bulletin for practitioners, so they can see where the newest evidence is, have that continual update. But I think this is an issue in terms of changing. It's one thing going through all the evidence and coming up with recommendations, which is a difficult process. The far more difficult process is changing behavior. And I don't think it's unique to medicine. I think if you look at any area of human endeavor, it's difficult. Once somebody learns something and they're practicing a certain way, it's difficult to sort of change the ship to go in a different direction. But we have to do it because it's about patient outcomes. You know, it's about making people better. And since the guidelines have been in place, the mortality has dropped 50%. And the people that survive do have a better outcome compared to before. And largely it's because of what we know works. You know, we know that about half the people in coma have high brain pressure. We need to measure it. If you don't measure it, you don't know what it is. And we have a paper that's about to come out showing that blind treatment, I just assume people have high brain pressure. I can treat everyone who comes in coma with mannitol, hyperventilation, and I'm not going to measure the brain pressure. It's like saying, somebody comes in I'm an internist, somebody comes in my office, I just assume they have hypertension. I'm going to give everybody blood pressure medication. Well, there's some consequences to that. And we're about to publish a paper showing that blind treatment without brain pressure monitoring leads to much higher mortality. Okay, so you should monitor the pressure and just treat those people who have high brain pressure. Don't assume from the CAT scan that a person has high brain pressure and start treating them, because that treatment could lead to other things which could produce a worse outcome. So I think the guidelines have been a service, been proven that they actually do impact outcomes and improve them. We need to apply them more thoroughly. I'd like to see the public be able to look at the evidence just as well as medical practitioners. We should make this transparent. I think that's probably the next big effort, is to give the public the tools to know what to look for. Right now I get calls, and a lot of people who are experts in traumatic brain injury get calls from somebody and saying, you know my cousin so-and-so, and he's in the ICU somewhere, and severe traumatic brain injury, what should we do? Well, they shouldn't have to call me up to do that. They should be able to have the facts in front of them and know what to look for. And that serves them well, and it serves the people in the hospital taking care of the patient well, because they're going to have confidence that the people in the hospital are doing the right thing, and they won't be taking them out, putting them somewhere else. So that helps everybody to have that knowledge transparent.